know that about 20% of those people, it's purely positional. So and predominantly that is on their back. So for those people, and this will show up in a sleep study, because if you have a sleep study done, one of the things they actually measure is your body position. So if they find that when you're lying on your back is when you have your sleep apnea, then the treatment and the management of that is to get you off your back. And there are cheap options. Cheap options are to just get someone to get a shirt, sew a pocket in the back, put a tennis ball in the back of the middle of the shirt. That makes it uncomfortable, and as a result of that discomfort, you tend not to lie on your back. So that's one option. Another option is that there's a special half moon type pillow that you can strap on. That the half moon sits on your back. So any effort that you make to try and roll over onto your back is pretty much thwarted, because you just can't roll over, and if you do, you'll just roll straight back over the other way. And then the other novel way, which is a little bit, I guess, a source of amusement, but it's a nice little story to tell. I don't know anyone that's actually done this, but it is out there as an option, and that is to get a woman's bra and to wear it backwards, and within the cups is to put tennis balls within the cups. Now that may be a source of confusion for some people through the passions of night. But look, from a practical point of view, there's another option.
Okay, fair enough. I mean, I'm trying to picture you advising your patients on such a novel way of fixing the sleep apnea problem. So I'm just having a little laugh here.
Oh, look, I think it's always good to have a little bit of sense of humour when you come to these things, because it is a serious thing, and people are sort of having trouble taking it on board. So you have that little giggle there, and it just helps diffuse the situation a little bit, and then actually makes them look at the other options a bit more seriously, knowing that that's the third option.
Yeah, that's right. And I think the biggest thing is people don't realise that, like what you just said, 20% of sleep apnea is purely because of sleeping position. It's just something that I guess we don't get educated enough, and people don't get told that if you change your position, you can improve your airway flow and get more oxygen flowing through your body at night.
Yeah, absolutely.